Hi everybody, I'm Evgenia Galinskaya and this is the first live stream from Other Options for Doctors. I'm a dermatologist by background and left clinical practice 7 years ago and have since been involved in career coaching for doctors who are thinking about leaving medicine or doing something else non-clinical on the side. So I have overall about 10 years of experience supporting doctors who are thinking about non-clinical options, as well as 3 years in the headhunting, so recruitment industry. And today I'm so delighted to have Melissa Theunissen joining us from Amsterdam. And I met Melissa fairly recently on LinkedIn, and this is actually a very good example of how important it is to network. Melissa has a very fascinating background. She is a GP and has transitioned into the exciting world of UX design. It seems like an exciting option for doctors who are thinking of leaving medicine, but would also like to be using some of the transferable skills they have gained, as well as their creativity. So I'm going to bring in, hi Sophia, hi. I'm going to bring in Melissa now. Hi, Melissa. So Melissa is based in Amsterdam. I'm speaking from London, so we are international here. How are you?
I'm doing really well, yeah. And
Excellent.
yourself?
So it's really exciting that you've gone through this career journey, or you're probably still going through this transition. I'm not sure how completed this transition is, whether you've completely broken off clinical practice. So perhaps you can give me a little bit of background how you made the decision, first of all, to leave medicine.
Sure. So, hi everybody, I'm Melissa, and I'm actually originally from South Africa, where I worked as a doctor for 6 years. I graduated in 2011 from UCT, and basically from there did my internship for 2 years, did my community service here for a year, and then worked for 2 years in anesthetics, and then worked for a year as a general practitioner. And in that time, I think I went through many of the challenges that I'm sure most of you are aware of, around the long hours, really just not feeling supported or appreciated by my team and the employers. And I think the biggest pain point for me was really around those really long hours and not having that emotional support and really feeling burnt out. And I think during those 6 years, I really tried to try different things. So I stopped working overtime. I switched from working in the public sector to working in the private sector. All in a way to try and see if I could try and find maybe that would make me happier in the role. But really just didn't feel like anything I did made me feel better, feel happy in working as a doctor. And I think I really started to identify that there was something really missing, besides just all the pain points that I was experiencing. I think for the first point would be really that I really felt I've always been a creative person, and I really didn't feel like I had that creative outlet in healthcare. I think to an extent you do have a creative outlet because, especially in South Africa, you have to make do with quite limited resources, and you have to try and figure out how you're going to take that blood culture or do this spinal on a patient when you don't have all the recommended things that you read about in the textbook. But you have people that help and show you what to do, or you have to make a plan yourself. So I think you become resourceful and adaptive. Yeah. But for me, that still wasn't enough to meet the creative need that I had. And I think the there was a few big other reasons, because I was getting more and more unhappy from all the different issues I felt. I just also ended up, when I did have less overtime hours and I ended up having more time for myself, that's really when all those buried emotions from all the things I'd been dealing with really surfaced. And I ended up really actually needing to get professional support as well. And I think it was soon after this that I decided that I should leave, because of the emotional toll and the physical toll that the job was taking on me.
That's very common. So the burnout in the medical profession is very prevalent, regardless of the country where the doctor is practicing. So what then happened? So once you've had that realization, what did you start doing? How did you explore your options?
So I think from there, I didn't know, I felt quite lost, I would say. I didn't know where to begin, where to start. I just started Googling, like, what can I do? Looking on groups, but nothing I saw there really fitted what I wanted to, fitted like what I was looking for.
Yeah.
And so I spent I think I took 6 months just really reflecting on what it is I actually wanted to do, what would make me happy, what is my, like, forming this kind of wish list of what is the things that I want in my next job or from my job. And basically from there, once I had that kind of list, I could look a bit better and see, okay, this is why I don't want to try that job or this job, because of it doesn't match this or it doesn't match that, or maybe it does match some things, like I know I have better work-life balance with that job, or this one I can be very creative. So I think you have to determine for yourself what is it that you want to get from your job. But I think how I discovered it was actually by chance, and that's also why I wanted to rather share that this is an option for other people, because if I hadn't have come across it, then by accident, I wouldn't be where I am today.
Okay.
And it was actually my ex-husband at the time. He's a software engineer, and he wanted me to do coding. And so he had taken me to a coding open day to do a boot camp. And I was sitting there and I was just like, oh, no, I don't think I can be a developer. I don't think that's something for me. But luckily for me, there was another guy that presented, and he got up and he was so enthusiastic, and he was telling us all about this thing called UX. And I was like, what is that? But it sounds really interesting. And I remember going home that day and I went on YouTube and I started just typing in what is UX, what is design thinking, and watched videos. And really, I just got really excited. So that's actually how I learned about it. And then basically applied for that boot camp and got in.
Oh, great. And by the way, Lauren Theunissen is saying big hello from South Africa. So you've Googled the boot camp. Can you tell us a bit more? What can a doctor watching this realistically do in terms of their research, so that they can find out whether it's really the right thing for them? Because I think boot camps are not that cheap, right?
Yeah, you get different ones. There's ones I think for different budgets. There's also online courses you can do, or you can do university accredited masters and other like specific degrees in it. But even before that, I mean, there's free courses, there's free meetups you can go to see if this is something that's of interest to you.
Okay.
And there's also, you can go look if the salary itself would be something that's enough for you. I made a we made the handout, and that's got a link that you can have a look in, because it varies across the world what you can earn. Yeah. So you can look if that's a possible option for you.
So just wanted to elaborate on that. So for anybody who is watching this right now, Melissa has kindly pulled up some really useful notes, which will be available when this video is uploaded on my YouTube channel. So if you subscribe to the YouTube channel, you will know when the video is already uploaded, and there will be a link to where you can get those notes from. And that will also include where you can research the salaries, because I know that many doctors really want to know whether the next role that they're going to commit to, whether that's going to be a long-term career or not, is actually going to be financially rewarding as well. And from my understanding, UX is a very versatile career and actually can be quite well paid.
No, I agree.
Okay, so my understanding is that you actually left clinical practice by the time you went to this boot camp. Can you tell us a little bit more whether it's possible to continue clinical practice and do this alongside? Because many doctors won't be in a position to leave completely, but possibly could do this part-time or in the evenings or on weekends. Is it possible?
Yeah, so it definitely is possible. I think there is a growing trend that people are starting to recognize more and more online courses, certificates, diplomas, and these boot camps. So I think it is possible to then do. There's also lots of people in this industry really think about who the employers are, and they realize that you might need to you have a family and things, or you might be doing this to transition into this. And so there's a lot of part-time courses that you can do in your own time, and then basically see if you can make a career from there. Okay. Once you have acquired those skills.
Okay. So perhaps at this stage, it would be really useful if you could tell us a little bit more about what exactly is UX design and why there is a separate niche such as clinical UX design, so that we can understand better what is so exciting about it.
So I have a book recommendation for those that haven't read it. It's called The Design of Everyday Things by Don Norman. And he talks a lot about what is design, because I think even if you ask most designers, they're not going to be able to tell you this is what it is. So I'm going to do my best to try and put it as simply as possible.
Yeah, and it's going to be in the handout as well.
Yes, I do quite a bit of explaining and provide quite a few links to videos to help explain the concept of what it is, because it's quite a large field. So we basically, if I can put it in a very more simple terms, it's basically a framework that looks at problem solving for products and services. And basically we apply this framework to identify the problems that the people that use that service or product have, and then from there try and figure out what's the best solution for that problem and implement it, and then test that it worked, and then do the process all over again.
So does it apply to like websites or apps, or what else?
So it applies not just to digital products, so like the websites, like YouTube, for instance, like Facebook, like Instagram, and it applies to, if we're thinking about within the healthcare, so your anesthetic machine, if you look at the screen there, somebody designed how that looks and how you interact with it. That was a UX designer. And if you look at the infusion pump, that screen. So it's also a lot on the medical devices. Okay. And it's, so if you think of any medical device, it can be health promotion material even. It can be how your private practice actually works, from how does the patient find out about you, how does the patient make the appointment, how does the patient then have the consultation with you, is it virtual, is it in person, what is their experience like, and then how do you get them to have the follow-up investigations and come back to you in a more seamless way than might happen right now.
Okay, so it's not just applicable to products, but it seems like you could also be doing some business consulting with this.
Yeah, there's many different niches, I think, within design. So you can even look at just how a team works and how a business works. You can look at the what we call the talk is around clinical UX, and that is specifically focused on any application or service in the healthcare industry. And if you practice in that space, you need to also be called a clinical UX designer. You also have to have a deep understanding of that how healthcare systems work and how healthcare situations may unfold.
Okay.
Like understanding informed consent, or how disease progresses and how a patient may react at different stages of grief, and all that kind of medical knowledge all helps in how you then develop an experience and a service and a product for that user.
Okay, and this actually ties in nicely with Sophia's question, who says, hi Dr. Melissa, could you kindly tell what your day looks like in terms of activities you undertake as part of your job, please? Thank you.
Sure. Hi, Sophia. So right now, I think my role has been, I've gathered some research. So whether that was looking online at competitors' websites, whether that was, I also did a survey with doctors. End of last year, I also did some interviews with doctors and tested our product with them. So showing them this is our search platform, and I want to watch you use it and get your feedback on how and watch and observe how you use it, and then document that and see how we can make that product better. And so it's using all that research, seeing how can we take what we learn from that research and then apply it to the product or service. And basically then what I do is I use a design tool, and the one I use is Figma, but there's lots of different tools to help you illustrate your ideas, basically. And so I turn all the ideas that I have from the research into actual tangible ideas that then we can test again with actual doctors. And then once we're happy that it works the way we want it to work, we hand it over for the developers to make it. And then if you visit a website, you're going to see the end product.
Okay. So is it mainly an office type work, sort of desk work, or do you meet a lot of people? Obviously, with the current COVID situation, it probably is difficult to be meeting people anyway. But before everybody moved to remote working, what kind of settings did you find yourself working in? Did you go to focus groups, for example? And if so, how much travel does that involve?
So I haven't had to do a focus group yet, but for example, the testing I did have to travel to a different city. So I traveled one city over to Rotterdam and to do the testing at the hospital. And so to make it convenient for the physicians I tested with, I did it at their place of work. Mm-hmm. And so it really just depends. It also depends on what your role is, because you can specialize. At the moment, I'm having to do a little bit of everything. And so I do a bit of research, I do design work at the end of the day. But specific companies may require you to only do the research, in which case you might be traveling quite a bit. Okay. Or you could also opt, like right now, people also do it remotely. So it really depends on where you work, what your role is, and you can also define what it is you want to do and what you're willing and capable to do. There's a lot of, I think, freedom and versatility in the role itself to define exactly what you want to do in the role.
Okay. And presumably it will also depend on the companies how they define the role. And maybe here you could explain a little bit better how doctors watching this could research what companies may have a role like this. Would it be medical device companies they would need to look up, or how did you find your company you're currently working in?
Yeah, so after the boot camp, I basically applied to any junior designer position that was available. Even a lot of them said they want 2+ years experience.
So you still apply?
People come, you still apply.
Okay.
First 10 months. So you just apply. And I applied mainly in the healthcare industry because that's where we have already quite a lot of experience and knowledge, and we have a lot of value we can add there. But I think it is quite versatile. My first job I landed was actually an internship at a communication platform in Amsterdam. And so it's really more about which company will see your value and how well you can show them how much value you would add.
Okay. So we have a couple more questions. So I think they tie in nicely with what we're currently exploring. So Susie is asking whether someone without a computer science or IT experience could get into this, and whether it would be helpful to get a master's degree in clinical informatics.
So I can just talk from my experience. I had no knowledge of computer science or data science or any technical background other than just using my mobile phone.
That's a transferable skill.
You can get into this without that background. But that being said, you will need to do at least some online courses on understanding a bit of coding, so a bit of the front end, because you are going to need to be able to work with the software developers. And so there might be a language barrier between you and them if you don't do at least some sort of introductory courses. So I just did an online course. I think it took me a week, I think.
Was it before or after the boot camp?
After the boot camp. Okay. So after the boot camp, I continued my education doing online courses.
Okay.
So that was a Udemy course that I did just to, I think because the only introduction I had in the boot camp was, I think they spent a day teaching us about, you'll hear HTML and CSS if you know coding lingo, but that's very, so that's front-end speak. But don't worry if you don't know what that is.
So you don't need to. You don't need to do much coding in this job, do you?
No, I don't code at all. I just learned a little bit about it so that I know and can understand what they're talking about.
Okay.
It's not a necessity to be able to do the job.
Okay. So my understanding is that a particular master's degree in clinical informatics or even in user design is not a mandatory requirement to get into a junior role. Okay. No. Okay. And we have a question, which bootcamp that was. Are you able to share that?
And so my company actually doesn't offer it anymore, which is why I don't usually advertise who it was. And they do still offer the coding, but they just ended up saying that they earn more money just offering the coding bootcamp.
So it was through the company you ended up getting the job. So people, I guess, could just Google bootcamps in UX design?
Yeah, so there's different ones per wherever you located. And yeah, I'm following at the moment the International Design Foundation, and I think I provided a link of theirs in the handout as well.
Okay, great. And because you mentioned some coding, Susie is asking which language would you recommend learning? I think it relates to the language of coding, Susie. Is it correct? No, it's not clear what she's trying to find out.
I think it really. I think the best thing there would be to ask that community. I don't think I'm in a position to say. There's so many different languages and they're changing. So it might have already changed from when I when I was informed which ones I should learn. But just starting with basic, the latest HTML and CSS for the front end.
Okay.
And basically it really depends also what your company uses. But I only know that, and I'm able to do it really well and hand over my design work to the developers.
I suspect also just, maybe from my end as a career coach, what I would suggest to people who have this question, maybe have a look at the job ads even before you get into this field. Have a look what the requirements are for these sort of jobs, and then you would have a better idea how to get that experience. Okay, so some couple of other questions that we had before, you had, Melissa, before, were about what you miss about being a doctor, and do you miss medicine?
Yeah, I think I don't miss practicing medicine. I think I do miss the amazing people I used to meet and the teams I used to work in. And there were some really amazing people there doing amazing things. And I think you do miss, that satisfaction of I've helped this patient and I can see the difference I've made in their life right now. But you don't always also have that in medicine. So I think it was kind of a two-way street of there's some things I miss, but for the most part, I don't miss working. And if I had a choice, if I could go back, I would not go back.
Okay. And what transferable skills did you bring into the world of UX design as a doctor?
Yeah, so I think you always have to think when you're trying to sell yourself in those interviews, what did you learn from your experience as a doctor that you can use? And I've kind of identified there's quite a lot, but I'm going to just mention 6. So even just your ability to empathize with patients and understand their context, that comes in enormous help when you need to do user research, because it is all about empathizing with the people you're trying to develop a product for and understanding what are their underlying needs, because it's not always clear. And that's exactly what we do as doctors, is we problem solve around what are the clinical signs and this is the diagnosis, or I need to do further investigations. The same thing you do in design. And you look at what are the problems the user's experiencing, and really diagnose that problem to come up with the right solution. And you develop really good communication skills, and this comes in handy when you need to present your findings to stakeholders, push for your solution ideas, and sell your ideas, as well as, I think, communicating well within your team. It's always important. And I think we make really good team players from working in a really multidisciplinary team. I think comes in handy when you're in design. You really have to work in a cross-functional team to be super effective in your role. I think we're all self-learners. We all have to be motivated to stay up to date with the latest clinical trials and the latest developments in our respective specialties. And so too in design, you have to still keep up to date with the latest trends, what's happening within the context of your business that you're working at. And I think the last thing would be really around that you are used to advocating for your patients and their rights. And so too in design, you have to make sure that your design is accessible to the people that need the service that or the product that you're developing.
Great. Well, thank you so much, Melissa. I think it's been a really excellent overview about this amazing option. And I actually wish I listened to this talk back in 2013 when I myself was considering what options I could have if I was to leave medicine. So thank you so much on behalf of everybody who's been on this live stream and who will be watching this in the future. For anybody who hasn't had a chance to catch up with us during the live stream, I will be posting this on my YouTube channel within the next 24 hours with the link to the handout that Melissa has mentioned, where she very generously shared some further resources. And also there will be some contact information for those who would like to learn more and contact Melissa or myself directly. So thank you once again. Have a great evening. Bye-bye.
Bye.